Well, let's start with the concept the authors are writing about, which is peer support. Peer support is an approach to helping those in mental health or addiction recovery that's led by individuals who've actually been there, have their own lived experience, and have had to navigate the pretty challenging system that we all have. This approach has been around for centuries, and with evidence around its effectiveness only increasing the last 3 decades. But despite the evidence, implementation and scaling up these interventions remains limited. So this article does something interesting. It uses the consolidated framework for implementation research to better understand how and why peer support interventions are implemented successfully. So the goal of the review is to really use that framework to help us understand ways that we can look at the barriers and facilitators. And there's several key takeaways for the field. First, peer support interventions are effective, and they're an effective way to augment and complement additional services for mental health and addiction. We should be including them in any and all discussions we have on mental health delivery. Second, it's important that any leader or organization looking to onboard or integrate peer support services does so by clearly explaining what they are and what they're not. The lack of clarity around peer support works against system-wide adoption. And finally, for peer supports to be most successful, it requires strong organizational leadership that commits to peer supports and an active vocal advocate for these services. There are other key takeaways such as the importance of training and maintenance, etc. But the bottom line, like any new service implementation, it can be challenging for frontline practices. And this article offers up suggestions as to how best to implement according to the best available evidence. I think this article holds up several important lessons for policymakers. First, and perhaps the most obvious, peer support interventions begin to address our significant mental health and addiction workforce crisis. Without embracing this aspect of the workforce, we run the risk of never having enough of the people we need when our communities actually need them. Second, policymakers may wish to consider these best practices when making funding decisions for mental health. Specifically, they may want to make sure that key implementation factors are laid out in any contract procurement so they can actively and proactively avoid any pitfalls. And then finding the right people to do this work will largely be dependent on laying out these clear expectations of what policymakers hope to see with their funding or contracting. And finally, and while not explicitly mentioned in the article, but always underneath the surface and something near and dear to my heart, is financing. We need to make sure that there are very clear ways to pay for peer support services and pay the peers a livable wage, something they can actually live on. While many Medicaid agencies already pay for peer support work, Medicare remains absent from this policy party. While there's federal legislation out there to address this, so far it has not moved forward. So there's an opportunity for policymakers there.